Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then we have Beckwith-Wiedmann syndrome. In the Beckwith-Wiedmann syndrome, there is enlargement of body organs are seen with hemihypertrophy, and there is renal medullary cysts are seen, and there are also abnormal cells are seen on adrenal cortex with macroglossia, omphalocele, and hepatoblastoma. So these are the main features. First, there is enlargement of the body organs are seen. There is big liver, big kidney, big spleen, all the organs are enlarged with hemihypertrophy. Hemihypertrophy means the baby is if you see the person's half of the face or half of the body is bigger than the other half. So that is hemihypertrophy. So this hemihypertrophy is seen. Renal medullary cysts will be seen in the medulla, and also abnormal cells in the adrenal cortex. Macroglossia meaning large tongue. Hepatoblastoma, which is nothing but Wilms tumor, is seen. This Beckwith-Wiedmann syndrome is associated with WT2 gene deletion on chromosome 11p 15.5. Okay, there is WT gene mutation is seen on chromosome 11p 15.5 is associated with Beckwith-Wiedmann syndrome.
thank you and thank you for watching.